Good afternoon. Can everyone hear me? We would like to welcome you to our 2021 Annual Nursing Award. We ask that everyone that's here face this way. Don't turn around, don't look to your sides, because we have special guests coming, okay? We're going to try to hurry this up because we might get some rain. So first of all, I'm going to ask Mr. Burnett to have some opening remarks for us.
Good afternoon and welcome. This past year has been nothing like any of us has seen in our lifetime. God willing, something that will soon be behind us. The entire CMH team pulled together to accomplish amazing things in the face of remarkable stress and adversity, and you did it with extreme compassion and professionalism. Nothing could exemplify this more than how our nursing teams face down their fear, uncertainty, stress, and fatigue to make sure our patients receive the best care possible. It is always a pleasure to be here at the CMH Nursing Award Ceremony, but this year even more than others, given what COVID-19 has wrought upon us. It just shows that despite what fate throws at us, nurses and other members of the healthcare team will be there to face the challenge and triumph. This ceremony is a time we get to recognize individuals who have demonstrated excellence in nursing at the RN and LPN levels. But like every other thing that occurs in CMH, it is always a team effort. So this event also recognizes a non-nursing individual who has provided outstanding support to their nursing colleagues as part of the patient care team. I want to thank the Shared Governance Council for their continued efforts to organize this event and their diligence in choosing this year's winners. I also want to prematurely congratulate this year's winners. I don't know who you are, but I'm sure you're much deserving of this recognition. Thank you, and happy Nurses Week, and happy Hospital Week, and happy Nursing Home Week.
Okay, we're going to move through this as the rain comes on, so I'm going to talk quickly. I want to good afternoon, and thank you all for coming this afternoon for the exciting annual event that we recognize two extraordinary nurses and an extraordinary care partner. I've had the privilege of being part of this event over the last decade, and is held during the Week of the Nurse, which is typically annually held on May 6th through the 12th to commemorate Florence Nightingale's birthday, which is today. Florence would have been 201 years old, and she would have had extraordinary fate that we're here with this. Her lasting contribution has been in the role in founding the modern nursing profession. She set an example of compassion and commitment to patient care and diligent and thoughtful hospital administration. She was known as the lady with the lamp, as all of us nurses know in our ethics, and that she was caring and ministering to the wounded soldiers. So I know you're not engaged to hear about a Florence Nightingale history session today, as we're here to recognize our CMH's outstanding nurses. However, I think it is important to understand that the principles of Florence Nightingale and practices remain today as the foundation for the nursing profession. The 2020 Annual Nursing Awards were held in August of last year, and we were standing out here about to burn up, and we were delayed due to the pandemic. However, little did we know, we thought the surge was over, Mr. Burnett, did we not? And we didn't know that the biggest surge was in December, starting 2020, to the quarter of 2021. Again, CMH nurses withstood some of the most difficult shifts to care for so many patients. Nursing remained resilient, and as an entire nursing body, joined together to provide care for the high census demand. I thank each of you for the tireless hours you have given to CMH for the delivery of nursing care in all the areas of organization. CMH's nursing operational framework is relationship-based care, Ursula Butts. Did you hear that? And it is the core of each CMH's nurses practice. I'm extremely proud and honored to be part of this nursing body at CMH. And I know each member on the nursing team provides compassionate care as stated in our nursing mission and vision that I would like to revisit one more time annually. We demonstrate compassion in all we do. We deliver safe, effective care that produces outcomes in a manner that allows nurses to leave at the end of the day, proud of what they have accomplished, knowing their care has made a difference. So as we move on to recognize our 3 shining stars for Nursing This Day of 2021, I would like to thank you, the recipients, for the compassionate and extraordinary care and your service and devotion you give every day. Congratulations, and you are the very best. Thank you.
Okay, at this time, Hazel Willis is going to give us a rundown of the history of the awards.
I guess you could say I've been around CMH for a very long time, because I was here when the very first awards were handed out. Very much appreciative of being part of that effort and being able to carry it forth up until today and hopefully going forward. We actually started this back on May the 6th, 2009. It marked a milestone for CMH nurses, mainly because one of the shared governance teams, which at that time was called Resource Professional Development. Today, it's known as Resource and Professional Development, canceled. Our goals in 2008 was actually to develop a way to recognize our nurses. We Googled, we looked, we searched. Nothing said it better than actually naming these awards after some of our own nurses at CMH and what they stood for. Some of you may not even know who they were, and some of you that are receiving the awards may not know. But to CMH, they were dedicated nurses, they were committed, they were hardworking, very dedicated to the profession of nursing, diligent in meaningful recognition for our nurses, and they courageously and willingly gave of their care to our patients. That was the main focus of these nurses and also the care partner. The care partner that it was named for, she was not a nurse, but she could tell you the name of every nurse that was at this hospital. And on any given day, you could call her and say, I need somebody to translate. She spoke very affluent other languages, and she would get up from her desk and come and translate. So the people that these awards were named after, they actually had a large influence, historical influence, on the high standards that were set at CMH and what the characteristics of nursing was all about at CMH. The honorees, Alice Tudor, the Professional Nurse Award, Carol Love, Licensed Practical Nurse Award, and D. McMillan, Care Partner Award, and the Ursula Butts Leadership Award. They set examples, led by example, each and every day. They taught us a lot of different compassions of nursing, such as taking your credentials from behind your name when you walked in the patient's room. We were a nurse. We were a caretaker. And setting that example to our patients, leading us by their leadership, leading us by their caring demeanor, and above all, the high standards for safe and quality care that's given to our patients every day. So we are very proud of these awards. Just a little bit of the history. The first of these awards, again, was actually presented in 2009. So we can say it's been a decade since we started these awards, and they're still going strong. We are very proud that Professional Development Council are very proud of the support that we get from administration, from our nursing leadership team, and for everybody that helps support us with these awards. So I'm going to be the next one in line to congratulate our winners, whoever they may be today. We want to congratulate you and know that you were not given these awards lightly, that you are setting examples for people that's coming behind you as well. Thank you.
All right. Are we ready?
Gotta go.
Okay. All right. The recipient of the 2021 D. McMillan Nurse Partner Award has been a care partner at CMH for 4 years. She is described as a caring person. She always has a smile on her face and an amazing attitude. She is always ready and willing to assist anyone with anything that is asked of her, whether it's a nurse, secretary, or another care partner. She is timely in her care for her patients. She is flexible and goes above and beyond in teamwork. She transitions easily when needed, which creates a very positive attitude and atmosphere to work in. This individual treats everyone equally and makes sure that her care is ethical and each patient is treated with a non-judgmental and caring attitude. The individual strives to promote care that upholds the patient's dignity and self-respect. She respects everyone while communicating the needs and promoting the well-being of the patient. She is always punctual and ready to go to work to make sure she demonstrates commitment to those she works with. This individual is a wonderful preceptor and trains other care partners in a professional and welcoming manner. She makes sure the preceptee gets as much training as possible during the orientation by seeking out every learning opportunity. The individual makes sure that the patients are cared for and that the nurses have the support they need, especially when they are overwhelmed with a heavy patient load. If she feels that there is a change in the patient's condition, she promptly finds the nurse and brings it to their attention, even if it's a small change, to ensure the patient can be assisted prior to a serious safety event. Are you ready? It is with great honor and appreciation that the Professional Development Council presents the 2021 Care Partner Award to Yolanda Sallie. Yeah, because my papers are getting wet. And we'll get fast. Oh, thank you. How about I put it I'll put it right here. Okay. Okay, let's give her another hand. Okay, now on to the Carol Love Practical Nursing Award. The recipient of the 2021 Practical Nursing Award has worked for CMH for 4 years. She is described by her nominator as a good listener and is well-spoken. The nominee always presents herself in a professional manner, from her dress to her mannerism. The nominee will stop whatever she is doing to assist other team members and never lets her task overshadow the team members' needs for assistance. Many team members have been observed saying, "She cannot have a day off because I don't know what I'll do without her." The nominee is an outstanding example of what relationship-based care is, Ms. Butts. The nominee is a member of the Quality Assistance and Performance Improvement Committee. As an active member, she collaborates with her team members to initiate several safety measures, such as the timely documentation and the implementation of a continuous care document, which simplifies the medication reconciliation process, thus reducing the margin of error for incorrect medication lists. This nurse exhibits integrity in her nursing practice. She is a woman of strong religious faith. She carries her beliefs and values with her on a daily practice. This nurse has been witness advocating for her patients on numerous occasions and is quick to speak up if she feels that ethical principles or values are crossed. This nominee is promoting her professional growth by pursuing her LPN to RN to BSN. She's doing this around 40 hours a week work schedule. Has dedicated her time after hours, weekends, to ensure that she meets her job requirements, school requirements, and maintains being a mother and a wife. It is with great honor and appreciation that the Resource Partnership and Professional Development Councils presents the Carol Love Award to Amy Lax.
Congratulations. We will get it right. We will release it.
Yeah, I'll fix another one too. Maybe you're over. Are you going to get later? Yeah. Okay, let's give her another hand. I had a hard time keeping that one a secret. I took out a lot of stuff. Okay, last but not least, the Alice Tudor Professional Nursing Award. The recipient of the 2021 Professional Nurse Award has been at CMH for 6 years. The nominee is described as one that does not shy away from a challenge and is diligent in her pursuit of improving practice. The nominee demonstrates integrity in her daily practice as she upholds the beliefs and the values of her patients. She has a soothing voice that instills a sense of calm and comfort for both team members as well as patients. In the times of high stress, she maintains a peace about her that is contagious. During the recent ice storms, the nominee tirelessly worked to contact her patients and families to ensure their medical needs were met. Her efforts were not lost as many patients and families in the community were left without power for weeks at a time. The nominee has fostered relationships with her team members and developed a trust amongst them that enables her the ability to teach and educate them. The nominator quoted, "I am confident in her skill set and put at ease in knowing that our patients and families will be getting the highest commitment to quality care as a direct result of the nominee's involvement." In addition to her own professional growth, the nominee has led educational sessions for our nursing assistants as required by state laws. She is a true inspiration to our team, patient, and our community. It is with great honor and appreciation that the Resource Partnership and Professional Development Council presents the Alice Tudor Award to Alfreda Brown.
We will get this as a dry copy, I promise.
Okay, let's give her another round. Okay, that ends our awards for 2021. We have cupcakes over here. They're individually wrapped, and waters that are small bottle waters. Take them when you go, and our winners, recipients, needs to wait for pictures. Thank you.